My name is Dr. Vlad Frenk, and I am a Fellowship Director of Regional Anesthesia at IA South with conjunction with Quinnipiac University Medical School.
What do you like most about working for IAA?
I came to IA via a circuitous road, and I worked in several practices prior to this, and this practice fits all my desires and requirements. I really enjoy the clinical volume and the kind of work that we do here. I find that my colleagues are a fantastic group of people to work with. I feel that we're really making a difference for our patients, and also I can see my family and spend time with them as much as I need to.
How do you manage work-life balance?
I take call, but IA is able to accommodate my call schedule and provide me with the time off when I need it. Make sure that I'm home on the weekends when I need to be home on the weekends, and I have enough time off to spend time with my family.
Is IAA an academic or non-academic institution?
Well, for me it's a little different because I come from a medical education background. Although I spent my entire career in private practice, I've been involved in medical education for a long time. I've been one of the early adopters of ultrasound-guided regional anesthesia techniques, and I've been teaching them since 2010. I have, as a way of background, Dr. Teresa Bowling and I were co-founders of Stanford School of Regional Anesthesia, which is an educational entity, and our YouTube educational videos are watched by many people all around the world. And my last job as a director of regional anesthesia for Napa of the Hudson Valley, I started anesthesia residency, and I served as a residency program director, which keeps me pretty focused and involved in medical education. So I don't feel that that's really a problem or an issue. From the standpoint of academic practice, I think that it's kind of a little misnomer where people feel that if they are working in the university, they call it academic, and if it's not university-based program, then it's academic. I really don't feel this distinction because we spend a significant amount of time and work discussing latest clinical research. We're discussing new alternative techniques, and we discuss patient care a lot. So I also feel that we are on the cutting edge of different pathways, clinical protocols, and various regional anesthesia techniques. So I would say that we're as academic as it can get.
Why IAA?
At this point of my career, I am very well aware of my clinical interest and things that I would like to accomplish within my clinical lifetime. And I feel that IAA enables me to meet these goals and to address the things that I would like to address as part of my career.
How did you start the Regional Anesthesia Fellowship?
As I mentioned, I have an educational background, and in joining IAA, we have a lot of very talented regional anesthesiologists from top programs in the country who join IAA, and we spend a lot of time in the anesthesia office discussing cases, talking about clinical pathways, and describing various regional anesthesia techniques. And during one of these brainstorming sessions, we thought that it would be a good idea to pass on our passion towards ultrasound-guided regional anesthesia to future generations of clinicians, and that's how we decided to start a training program. And we were fortunate enough to form collaboration with Quinnipiac University, which we feel would give our fellows exposure to the university life as well to university resources such as a library, cadaver lab, and state-of-the-art simulation center.
What distinguishes your fellowship program from others?
As opposed to many other practices, our physicians and clinicians are not expected to teach. So all the education that people are involved in and would like to get involved in, it's on their own interest. They have very strong passion for teaching, and we also feel that people who are coming from all and who are trained from all over the country, from various programs, bring all their experiences and all their backgrounds with them, and drawing from all these places, we're able to get the best techniques. Second of all, we believe that consistency in techniques and consistency in clinical pathways breeds consistency in outcomes. And we spend a lot of time developing clinical pathways and adjusting them, and we would anticipate that we will teach our fellows how to develop these pathways, how to start acute regional acute pain service, as well as how to how to be proficient with medical billing for regional anesthesia, and how to build the service.
What are you looking for in new members to your fellowship?
So we anticipate that people will be proficient with most regional anesthesia technique by the end of their residency. So when they start their fellowship, our job is to make them experts. So what we're looking for and what we're going to train is slick, proficient regional anesthesiologists who would feel very comfortable in a busy clinical practice with a high volume and fast turnovers that would be sought out by different practices and the surgeons together as well.